Mr. Speaker, today brings the culmination of an extensive and spirited debate over health care reform. Both parties agree that the status quo is unacceptable. Obviously, we disagree on how to fix what's broken. And as the gentleman from New York just said, there are times in this body when we really can tell the difference between us Republicans and you Democrats, and this is certainly one of them. Mr. Speaker, the Democrats' solution is a 1,990-page, trillion-dollar overhaul of the health care system we know, a sweeping new entitlement that raises taxes, cuts benefits to seniors, and, Mr. Speaker, it spends over $1 trillion that we don't have. Republicans believe there is a better way. We have proposed an alternative approach that offers a stark contrast to the majority's plan. It is a fiscally responsible and reasoned approach. The majority's proposal overturns the whole system. We keep what works and then try to fix what's wrong. Their bill puts the government between families and their doctors. Ours doesn't. Their plan cuts Medicare benefits to seniors. Ours retains them. Their proposal blows a hole in the deficit. Ours actually saves money. Their bill imposes penalties and mandates on our small businesses that costs jobs. Ours does not. Specifically, Mr. Speaker, our bill will help you access health care if you lose or change your job. And it will ensure that you have access to medical care if you have a pre-existing condition. And we also, Mr. Speaker, deliver on something that the majority refuses to even talk about, and that's real, meaningful medical liability reform. And most importantly, Mr. Speaker, we produce cost savings for workers, families, and small businesses. The Congressional Budget Office says that the Democrats' new government-run system won't reduce costs. CBO says our legislation lowers health care costs. In fact, CBO says that the Republican plan cuts premiums by up to 10% for employees covered by small businesses, up to 8% for those not covered by employers, and up to 3% for employees covered by large businesses. Mr. Speaker, in the face of 10.2% unemployment, Americans want jobs. They want less government spending and more economic security. The majority's bill shows they have not listened. Ours shows we have. Interestingly, Mr. Speaker, the only bipartisanship on Capitol Hill today will be in opposition to Speaker Pelosi's trillion-dollar-plus government overhaul of America's health care system. And with that, Mr. Speaker, I urge passage of this substitute, and I yield back.